Good evening and welcome. Starting with our big story, as world leaders reiterate their pledge to tackle climate change, the World Health Organization has toughened its air quality guidelines after 16 years. The guidelines provide an assessment of health effects of air pollution and thresholds for harmful pollution levels. The revised WHO air quality guidelines are based on the following parameters of particulate pollutants and greenhouse gases in the air. This after numerous studies were published in the past decade, demanding a revision in the guidelines.
Because of air pollution, the simple act of breathing contributes to 7 million deaths a year. Almost everyone around the world is exposed to unhealthy levels of air pollution. Inhaling dirty air increases the risk of respiratory diseases like pneumonia, asthma, and chronic obstructive pulmonary disease, and increases the risk of severe COVID-19. These new guidelines will have major implications for public health. They provide a practical tool for improving air quality around the world and a robust evidence base for developing national and local air quality standards. They can also help to inform and strengthen policies in sectors including energy, waste management, agriculture, and transport.
The WHO highlights the health risks posed by air pollution. According to experts across the globe, toxic air results in a host of chronic and acute respiratory and cardiovascular ailments. The WHO chief says air pollution claims over 7 million lives per year worldwide. Most of the air pollution-related deaths come from middle and low-income countries. Southeast Asian and West Pacific nations report the highest number of deaths. Apart from outdoor pollution, indoor pollution caused by dry and fossil fuels also results in significant number of deaths. Cleaner transport, energy-efficient homes, power generation, industry, and better municipal waste management are all likely to reduce the key sources of outdoor pollution. New guidelines is stricter than the previous ones. Now, this is a particulate pollutants result in adverse health conditions. According to the U.S. Environmental Protection Agency, ultrafine particles pose a higher health risk than the larger ones. New researchers suggest that people affected by toxic air are more susceptible to risks and complexities of COVID-19. Over 15% of global COVID deaths are linked to ultrafine particle pollutants, and researchers opine that air pollution is one of the major reasons for COVID-19 deaths. Experts say countries must realign their air quality standards with that of the WHO and need to invest in policies, equipment to fight the menace, because cleaner air means longer life.
WION, now available in your country. Download the app now. Get all the news on the move.